Hello, everybody, and welcome to today's live stream. I am, moving this around so I can see your comments without having to look up to the ceiling. I hope everybody is having an absolutely amazing day and had a great weekend. It was a little bit cool here, and I know all those people in Florida got really smacked by some treacherous weather this weekend, so I hope everybody is safe and dry. Good morning, Summer. Please, if you have any questions, feel free to ask them of me. I am here at your disposal for the next 30 minutes to an hour. We'll see how things are going. How do we solve our PTSD ourselves? That's a great question. When we experience trauma, we are left feeling unsafe and disempowered. All of a sudden, the rug was pulled out from under us. And the ongoing effects of PTSD, the symptoms of PTSD, when you look at them from that perspective, have developed in order to try to help us feel safer and more empowered. Hypervigilance. I'm not going to get caught off guard again. Negativity or pessimism, expecting the worst so you don't get surprised. Withdrawal, being just too exhausted to deal with people. Sleep difficulties. The body doesn't want to go into a deep sleep when we are not feeling safe. So that goes along with keeping that stress response system activated. I say all that to follow up with identifying what it was about the trauma that caused you to feel unsafe and disempowered, and processing that for sure, but also recognizing in your current situation that you are safe and all of the ways you are empowered, recognizing in your current situation the triggers that may be bringing up those memories, may be activating that PTSD, and exploring ways that you can mitigate or cope with them, or maybe even eliminate them. PTSD, in most cases, results in or develops after, depending on the person, the HPA axis becomes dysregulated. So it's going to be important to recognize that there were physiological changes that took place as a result of that trauma. And it's going to be important to release trauma from your body and heal that nervous system, strengthening vagal tone, that vagus nerve, reducing, and I know this is the hardest one, reducing unnecessary stressors. When we are healing our HPA axis, it is sort of akin to trying to recover and get your heart rate back down by jogging after doing a sprint. You really want to just sit down and, let your heart rate go down. But unfortunately, you can't. And the same thing is true in life. Most of us can't just take off 3 months and say, hey, I'm just going to take a cruise or go out to an island somewhere and not be bothered by anybody or anything for the next 3 months and let my body heal. It's just not possible. So you have to recognize that you are going to, it's going to take a little bit longer to heal that nervous system because you can't get rid of all the stressors. It's just not possible right now. So being kind to yourself, being compassionate with yourself, when you do that, eliminating as many as possible and mitigating the rest. For example, if you are told you have high blood pressure, then one of the things that you might start doing is regularly checking in with yourself when you start to get irritated, saying, is this worth getting my pressure up? And I'm not saying that you have high blood pressure. That's not a symptom of PTSD, but that's one of those physical issues that a lot of people can relate to. So ultimately, processing current situations to help you feel safer and more empowered, healing your HPA axis and your nervous system, strengthening that vagus nerve, and also processing the trauma and the ways that it is currently impacting you in the present. The trauma happened. It sucked. Whatever it was or they were, it was awful. And acknowledging that and then processing that. Grieving, a lot of people miss that step in trauma processing. Grieving the loss of that idea you had of what the world was like, of being safe, of all those things. And the change doesn't mean you're not safe now, but it means that you never expected that to happen. And that just kind of shattered your worldview for a moment. That's what I would start with. I'm a firm believer in EMDR, especially for processing anxiety and stress in the moment. I'm not a firm believer of self-administered EMDR for processing trauma issues, because that can just open up too many wounds and it can get too intense too fast. But for feeling anxious in the moment, that can be self-administered, if you will, EMDR can be helpful. All righty. Well, I see a lot more people have logged in. Welcome to everybody. Good morning, Norman. You know, that's a really good question, Levi Labs. I am not sure how you would use techniques from EMDR for writer's block. You know, just kind of spitballing, if you will. When we engage in EMDR, what we're basically doing is separating the emotional from the cognitive. You know, we're kind of processing those memories. So it might be, depending on what you're writing about, it might be helpful to engage in the EMDR processing or engage in those techniques while you are brainstorming in order to remove some of the anxiety that might be blocking you. Or processing, there we go, processing the anxiety that is contributing to your writer's block. That it will be rejected, that you don't know what to say, whatever it is, those thoughts that you're having might be a technique that you could do. I don't know, but it's a great question, and it would be interesting to do a little bit of research on that for, like, you're identifying some practical ways to use EMDR in day-to-day life. I have a hard time relinquishing control due to codependency and PTSD. Yes. And that is a core feature of the trauma. When you experience that unsafeness and disempowerment, you weren't in control and you were hurt physically, emotionally, you know, however you were hurt. And it was terrifying. So your brain now says, no. We need to control everything, and we're going to hold on to it as tight as possible. In codependency, you may have grown up in an environment or been in an environment in a relationship in which the other person was engaging in unhealthy, unhelpful behaviors, and you learned it wasn't safe to relinquish control. You were trying to control that person in order to keep you safe as well as keep them safe. So it totally makes sense. One thing I would encourage you to do is explore in the present the issues that you're trying to, or that you're feeling the need to control, and explore those in terms of, okay, control is on a spectrum, and what would happen if you loosened your grip just a little bit? Is this person in this context likely to, do something wrong? And it's important to remember, whoever was in your life that created the dynamic of codependency, They were not a safe person. It wasn't that they were trying to be malicious. It was they were hurting so much themselves, they were struggling. But it ended up having negative impacts on you. So in this context at this time, is this person safe? If you're thinking about like a friendship or a romantic relationship, if you're thinking about your children, in this context at this time, what would happen if I loosened my grip, if you will, on controlling my children's lives? Do they have the skills and tools they need to make the right decisions? And will they? And that's really terrifying if you've grown up in a dysfunctional household and you don't want your kids to experience the same thing, to make the same mistakes that other people have. You want to protect them at all costs because you weren't protected. Recognizing, again, this context, this time, how unsafe is it to loosen control, but also exploring what does needing control in this situation mean? Like I just said with the kids, you weren't protected and you want to prevent that from happening to your kids. So processing your anger about not being protected, getting together, if you will, with your inner child and letting them know, hey, our parents or our caregivers or whomever didn't protect us. You're right. And that was awful. But I'm here now. And I've got this. I'm going to protect you. It's not going to do everything. However, it's important to recover if you want to be less controlling, if you will. You've got to step outside of that envelope. You've got to, or loosen that grip just a little bit. We'll keep the metaphor and see what happens. And if nothing bad happens, then you might be able to loosen it a little bit more and see what happens. Again, based upon each individual person in each individual context. Can you tell us about BPD, where it comes from, how to diagnose it, what happens when you split, and how long does it usually last? Okay, so borderline personality disorder, I'm assuming that's what you mean, besides not bipolar. Borderline personality disorder is a set of behaviors that develops in people who generally, like 99.999% of the time, have experienced severe and potentially ongoing trauma when they were children. And it's important to remember that children don't think in spectrums. Young children think in all or nothing terms. My caregiver is safe, my caregiver is unsafe. My caregiver loves me, my caregiver hates me. My caregiver will protect me, I'm on my own. And that's where that splitting comes from. That inner child sort of comes out, if you will. A lot of times the person with BPD symptoms, and I've made the argument before, and I'll continue to make it, that I think most of the cases of what we call borderline personality here in the States is actually complex PTSD. But we don't have CPTSD in the DSM-5-TR. It's only in the ICD-11. So we can't, in most cases, officially diagnose it here. But I digress. When that child experiences those traumas, they are terrified and they remain terrified. The environment is chaotic. They don't feel safe. They feel disempowered. And that causes their HPA axis to dysregulate. Now and stay on a lot of the time. They don't feel safe, so they're going to constantly scan to try to keep themselves safe. They want to survive. They want to survive. So what happens? When we are in fight or flight, we aren't able to access a lot of our higher order cognitive processes. Sometimes not at all, but definitely not as efficiently. So a child who is consistently under stress, who is consistently terrified, is going to have difficulty learning new coping skills. They're going to have difficulty learning at school and everything else, but they're going to have difficulty progressing and learning new coping skills in that they can use in adulthood as they grow, because they're trying to survive. They're trying to protect themselves. Additionally, as that HPA axis becomes dysregulated, they start to experience what we call emotional dysregulation. And what that means is, just like when you drink alcohol, when you first drink it, you can get a buzz off a couple of drinks or less. But if you consistently drink it, it takes a little bit more to get that buzz. Your tissues, your receptors become tolerant to it. So it takes more to get the same effect. People who've experienced trauma, the same thing is true for their stress chemicals. Before the trauma, when they experience stress, it didn't take a whole lot of cortisol and other stuff in order to trigger that stress response. And then it would go back to normal and everybody was happy. But when that stress response stayed on too long, those receptors became less receptive to the cortisol. So it took more cortisol in order to get the same response. So what you see is, in people who are emotionally dysregulated, a lot of times when they're not under stress, they're pretty much flat. There's not a lot of euphoria there. They're pretty much flat. But then when they get triggered, instead of having that, trickle of cortisol and stress hormones to trigger the stress response, they have a tsunami. I mean, just a big city-destroying tsunami of stress hormones that come in and trigger the stress response. So their emotional response is what a lot of people consider overreacting. It's more extreme. Well, the physiological response was a lot more extreme as well. And it also takes them longer to wind down or to recover and get back to baseline after they get upset, because there's so much more stuff that needs to be cleaned up, or water that needs to be drained out, or whatever metaphor you want to use. I'm mixing my metaphors a lot today. So those things are really important. The diagnosis, there are criteria in the DSM, and I have several videos on diagnosing borderline personality, but really a lot of the key factors are an unstable sense of self. The child, when they grew up in that environment, they never really learned who they were. They were too busy trying to survive. And in many cases, the child was also being very chameleon-like, because they figured, well, if I do whatever this person wants me to do, or I be whoever this person wants me to be, they won't abandon me. And if they don't abandon me, then I'm safe, because a 2-year-old can't go get an apartment somewhere. So they don't learn what they like, what they want. All they're interested in doing is keeping the peace and avoiding abandonment. So then fast forward to adolescence and adulthood, there's still these abandonment fears. They never have felt safe. So they're hypervigilant to indications of rejection. That inner child is still active. That inner child is still fearful. And many times the person, since they don't know who they are, they rely on other people to tell them that they're okay, to tell them what to be, to tell them how to act and what they should be interested in. And then that'll give them acceptance. So it's important to break out of that and help people establish a sense of self so they can not abandon themselves, so they can start living authentically and engage in authentic relationships. So unstable sense of self, that splitting, and the splitting depends on the person. But it's important to remember, as I said, it takes people longer to get to baseline after they get upset. So the splitting occurs when somebody gets upset. You go from all good to all bad. And it will take until they downregulate, until they get back to baseline and process it in their wise mind to recognize what's going on. For some people, that may be a couple of hours. For other people, maybe a couple of weeks. It depends on the person and the extent of their dysregulation and the extent of their skills in processing what happened once they are able to get into their wise mind. If you can't concentrate while studying and need to take a walk after 10 minutes of studying, that could be ADHD. It could be an anxiety disorder. There's a lot of things that could contribute to that. It could be you just hate what you're studying. So before pathologizing it, I would really encourage you to go online and look at the different diagnostic criteria for those things. Now, OCD, obsessive compulsive disorder, is when you have obsessive thoughts that just overwhelm your mind and you're fearful if you don't engage in particular behaviors designed to protect you. So a lot of people with OCD, for example, they may lay down in bed and try to go to sleep at night, but then they start wondering if they locked all the windows and they locked all the doors, and they can't get that out of their head. So in order to silence those thoughts, they have to get up and engage in that checking behavior. So OCD is somewhat different. That's not going to present quite the same way. What's the difference in healing from acute stress disorder and PTSD? Duration. That's really what it comes down to. Acute stress disorder, and I hate the term disorder, I really do. Acute stress response, I think, would be more appropriate. And that occurs for the first few weeks after a traumatic event. If the symptoms persist after 6 weeks, then we start looking at a PTSD diagnosis. And in terms of the brain and the body and everything else, obviously the longer symptoms go on, the more physiological changes are going to happen, the more the nervous system is going to get worn down. You're not 6 weeks of not sleeping well is going to take its toll. But 6 years of not sleeping well is going to take an even bigger toll. So it's important to recognize that it's really a continuum. But that's a great question. In terms of recovery, the basic tools and strategies I use working with people are really quite the same or quite similar, because the issues of unsafeness, disempowerment, and grief are really very similar as well. Do antidepressants work for everybody? No. They found that antidepressants only work for about 30% of the population. And thank you for asking that, because this is one of my soapboxes that I just love to get on. It's important to recognize that what causes depression can vary. And people who are taking antidepressants when they've got hypothyroid, that ain't going to do nothing. That's probably not even going to change a bit what's going on. So there's physiological things like hormone changes and hypothyroid that can contribute to it. There's nutritional deficiencies like anemia and vitamin D deficiency that can contribute to it. There are social issues, like if you have ongoing abandonment anxiety, if you've got unresolved trauma that is just draining your energy, trying to deal with that, keep it under wraps, cope with the triggers on a day-to-day basis, that's freaking exhausting. And that can contribute to symptoms of depression. So we've got to figure out what is causing the depression, not just assume that every depression is the same. And so I think it's important that people who have mental health symptoms, depression, anxiety, mania, attention difficulties, they get a physical. Let's rule out the easy stuff first. If all of those things are status quo, then we can start looking at other factors, other contributors to the person's mood symptoms when they started, when the symptoms started, what makes it worse, what makes it better. And a lot of times we can find a trigger or a set of triggers. Sometimes, like with burnout, those triggers happen over a course of 6 months to a year, but it is important to recognize that if those stressors that are causing you to feel hopeless and helpless are still ongoing, a pill's not going to do everything. That's just the way it is. A pill may alter your neurochemistry a little bit, but if those stressors are still there, draining you and triggering you to feel hopeless and helpless, it's not going to change your thoughts. And that's really where we look at behavioral issues like not getting enough sleep, nutrition, and then cognitive issues like thought processes. My professional experience, let's see, back in 1998, I did my first internship in a co-occurring disorders treatment facility. It was mainly at that point a 12-step facility and mainly identified at that point as an addictions facility because the term and concept of co-occurring disorders really hadn't caught on yet. I worked there ultimately. I ended up doing my residency there, and the remaining 14 years, I went from line staff to program director to unit director to program director to multi-program director at that point. And I really loved it. I really loved it. I love working in community mental health, love working in residential, love doing groups. I love writing grants. One of the things that my boss used to do, he recognized that I tend to get bored. And whenever a grant would come up, I would help write it. And then when we were awarded the grant, or if we were awarded the grant, I would generally be the one to head up the program, start that program, get it on its feet for 2 years, and then in comes the next grant that we're working on. So I really enjoyed that. I enjoyed the flexibility that Richard gave me. At one point, I was supervising two residential programs, one for children, one for adults, a detox facility, an outpatient program, an intensive outpatient program in 4 different counties. So I had a staff that I directly supervised of about 130 people over the course of, or indirectly supervised, and a staff of about 80 people most of the time that I directly supervised. And that was because a lot of times we'd lose a unit director here and there, so I would end up supervising a unit. I wouldn't trade it for the world. If the pay was better, I'd probably still be there. But there are challenges in community behavioral health because every year, since you're state funded, every year when the mental health budget comes out, you're just crossing your fingers and hoping that you're going to get enough money in the budget to keep all your staff for the upcoming year. Are there things that I would do differently? Certainly. But I think the agency that I worked for, did their very best to provide services to as many people as they could, given the funding that they had. And I think they did a really good job most of the time. Like I said, there are things that I took issue with, but nothing's perfect. And I recognize why they made the decisions they did. I went into private practice for a while, and I was in Florida doing private practice, in Virginia, and then here in Tennessee. And I really enjoy private practice. But during that time, let's see, 2006. So starting in 2006, I was in the Community Behavioral Health Center for 14 years. Overlapping with that, I started AllCEUs, Counselor Continuing Education. And we were the first ones to offer unlimited online CEUs. So that was a disruptor, as they call it, and it greatly reduced the cost of continuing education for clinicians. It used to be like $15 per CEU, so it's $450 every renewal in order to get the CEUs you needed. And I'm like, we don't get paid enough to pay that kind of money. So I did start AllCEUs, and I've been very blessed that it has been successful and continues to grow even today. Then along the way there, my husband started helping out with AllCEUs. I took a job as an assistant professor at the University of Florida, worked there full time while I was also working in the community behavioral health full time. And then eventually I got tired. I'll admit I got tired. And so I went into private practice. And that's about where we are now. I run AllCEUs, and I have a small private practice right now, which we are getting ready to make bigger because of the changes in the YouTube viewership and revenue structure and everything. So I'm going to step away from putting out as many videos and get back to basics. I've put out a couple of books. They're available on Amazon. You can just search by my name and you can find those on Amazon. You can read them for free with Kindle Unlimited. So yeah, I think that's kind of a roundabout view of my clinical experience. Whoops, it jumped on me again. Let's see. And good morning to everybody who's joined us. And if I miss your question, I tell you this every week because I don't want anybody to get their feelings hurt. YouTube, as soon as I start to scroll, will jump all the way to the bottom, and I have to scroll back up to try to figure out where I was. So if I skip your question, it means I didn't see it. Please ask it again. Rajni asks, I would like to know how stress, anxiety, and depression correlate with each other. Great question. Stress is kind of another word for anxiety. It is when you are feeling pressured about something. When you're feeling stressed, you feel pressure. And that pressure comes from some level of anxiety about the need to get something done, or, well, a lot of times it's the need to get something done, or feeling like you're out of control of certain things and having difficulty with that. So stress and anxiety are really kind of, I conceptualize them on a continuum, but they kind of go together. You can also have physical stress, and physical stress is anything that takes your energy. So it's important to remember that when you are emotionally stressed or cognitively stressed, you need to try to reduce as much physical stress as possible because you can only deal with so much stress. You only got so much energy. When you're anxious, that means your stress response system, your HPA axis, is activated. So you are in fight or flight. Now, going back and forth between fight or flight, depending on the situation, is exhausting. And keeping that stress response system, like I talked about with BPD, keeping that stress response system activated will cause those tissues to become less responsive to the stress hormones and the excitatory hormones, which means it's going to be hard for you to feel excitement as well as anger or anxiety. So you feel more flat. Now, depression is generally characterized, in addition to feeling exhausted and sleep changes and eating changes, as a feeling of hopelessness and helplessness and apathy. So it's important to examine where that came from. And a lot of times when people feel anxious, they feel like they're not in power. They feel powerless, which can translate, if they don't feel like they can get their power back, they may start feeling hopeless and helpless. So they really kind of feed into one another. And it's a great point that in the majority of cases, and I'm not even going to ballpark a percentage right now, but it's over 50% of the cases, the people that I've seen who present with depression also have a lot of ongoing stress. The things that used to make them happy aren't there anymore. They may have grief, they may have anxiety, they may have anger that are draining their energy and contributing to their feeling of hopelessness and helplessness. Can adrenal supplements help with anxiety and depression? That would be a question for your doctor. New York, I am thrilled that you have found us. I appreciate your support, and I'm glad what you found us to be helpful. Is there a connection between bipolar and anger issues? There certainly can be. People with bipolar disorder, it's important to remember that they're not always depressed or manic. They can have a depressive episode, and they can go for months or even years and then have another depressive episode, and then months or even years. All that you need for a diagnosis of bipolar disorder is one manic or hypomanic episode in there. So it's important to recognize that people don't always flip-flop. You don't just go from being manic to depressed to manic to depressed. There's often a lot of times where somebody is in remission, if you will. However, especially when someone is in a hypomanic state, and even a manic state, they tend to be more impulsive. They tend to have more of a flight of ideas, and they can be more irritable. So yeah, I do see a connection. When people are in a depressive state, when you're depressed, you're feeling hopeless, helpless, apathetic, what's the point? And then something else comes and you don't have energy to get up sometimes to get up and feed yourself or take a shower. Something comes that needs your attention. It's like, I just can't freaking deal with it. So then you have that flood of stress hormones that can cause you to be more irritable. Anytime you're in what I'll call a dysphoric mood, not a happy one, you are more vulnerable to triggering that stress response. Not sure what the question is, WJK. Carl Rogers' approach is humanistic. If a person's suffering from depression and their home environment is also not good, what should we focus on in counseling? Ideally, family therapy. But if that's not an option, encouraging the person to figure out what they need to do to help themselves feel safe and empowered. I would encourage them to define their rich and meaningful life. What would it look like if they weren't depressed? What would it look like given their situation? So, if they're staying in that home environment, there's a reason. Whether it's because they don't believe in divorce, they don't believe in leaving their situation, or they're a child and they can't get out of that situation yet. There's a lot of reasons people may be stuck in a less than optimal home environment. Teaching skills, identifying what's creating that less than cordial home environment. Is it other people in the household who have addictions or mental health issues or communication issues, and how to cope with that? Recognizing what's their stuff versus the client's stuff. If we'll just say caregiver, if caregiver comes home and they're in a god-awful mood, that doesn't have to do with you. That has to do with them and whatever happened during their day. Even if they do get angry and snippy with you, stepping back and going, that's about what's going on with them. I just happen to get in the way of their anger, of their rant. Doesn't make it feel a whole lot better, but recognizing, not personalizing it, can help the person deal with it a little bit better, and recognizing what they need to do to stay safe. Again, it may not be safe to confront the person and say, hey, I really don't like it when you talk to me that way. That may cause more problems. So I don't want to encourage people to do things that could put them in danger. Learning how to set and maintain boundaries as much as possible in that environment. Again, may not be completely safe to completely maintain boundaries, but it's important to recognize that if they are staying in the environment because they just don't know what other options there are, then that's something else that you could explore in therapy. What options are out there? I don't know what state or country you're in, so I don't know what types of resources that are out there. For example, for people with that are struggling in a house that has domestic violence. But sometimes, I worked with hundreds of people who came into treatment and they worked really hard on their recovery, and their significant others didn't do squat while the person was in residential for 60 days. And so the person made a lot of progress in residential where they were safe, where they were in a comfortable or supportive environment. And then they go back home to that same dysfunctional environment and they start backsliding. Worse yet, if the significant other or the family is still using, and then they're just like steeped in triggers and everything else. We would do a lot to talk about how to maintain boundaries and protect themselves in those sorts of situations. But ultimately, the person generally had to make the decision, if my loved ones are going to continue to use after I get out, or if they're going to continue to be dysfunctional, is this a safe environment for me mentally as well as physically? And Benjamin, your mind knowing it's over is great. However, as they say, the heart wants what the heart wants, and your heart really wants to feel safe. It got hurt, and whatever the trauma was, it got hurt from that betrayal, from that abandonment. And it's going to be important to process and grieve that trauma wound. There's no easy way around it. It sounds like there is a loss that needs to be processed. And as with all losses, that grief doesn't just go away in a couple of weeks. It may periodically come up, but what we hope is when those trauma bursts occur, or grief bursts occur, they are less intense and more controllable. You recognize them, you say, okay, this reminds me of that time. This really sucks right now. However, in the current context, I'm safe. In the current context, I have power. In the current context, I'm loved. Whatever it is that you work out to tell yourself in order to help yourself put salve, if you will, on that wounded heart. Having kids is a scary thought. How do you not mess one up? You don't. You're going to make mistakes. The wonderful thing about children is they're resilient. The being mindful as a parent is really important because children learn what they live. They learn a lot more from watching you and what you do and how you react to them than they do by what you tell them. So that's important. Being mindful and trying to live a healthy life, not just physically, but emotionally, as much as possible. Model the skills you want them to learn. And when you make a mistake, admit it. So they learn it's okay to make mistakes. When you screw up, you screw up. And it's important for them to recognize that parents make mistakes too. And it doesn't make you less lovable as a person. It means you made a mistake. So a lot of not screwing up a child goes with being as healthy of a parent as you can and continuing to be mindful of what the child needs and encourage them. A secure attachment goes a long way to helping children be as productive and happy and healthy as possible. In order to stay healthy every day, it kind of depends on what you're working with. So mindfulness is a huge thing. Starting the morning out, and I've been working on a bunch of worksheets for the Doc Snipes site and the Doc Snipes training site. But I believe that practicing morning and evening mindfulness is essential to being happy and healthy as much as possible. You're not going to be able to be perfectly healthy and pain-free and happy every day of your life. That ain't going to happen. But recognizing what your rich and meaningful life is, recognizing the aspects of your rich and meaningful life that you have that are going well, recognizing progress toward using your energy to achieving your rich and meaningful life can also be helpful. And that's where morning mindfulness gets your mindset, helps you remember to focus your energy on what matters. Evening mindset helps you, assess what's going on with you physically and mentally. Reflect on the day. See how well you accomplished what you would set out to accomplish. Learn from it. If you got sidetracked somewhere and used your energy kind of needlessly, then learning from it and saying, okay, how can I prevent that diversion next time? Or maybe it was a welcome diversion, and how can I schedule that in as part of my rich and meaningful life? But that can really help people reduce their stress levels. And honestly, for a lot of us, the simple question to ourselves, is this a good use of my energy to help me move toward my rich and meaningful life? Whether you're getting upset over somebody cutting you off in traffic, or something that you went to buy at the store that was sold out, or somebody being rude, or the news, or whatever. Whenever you start feeling yourself getting anxious or angry, asking yourself that question, is this a good use of my energy to help me move toward my rich and meaningful life? If not, what's a better step? And each situation is going to be different. For example, if your kid was supposed to be over for dinner at 5 o'clock and they never showed up, then, and it's like 8 o'clock now, you're probably going to be worried. However, do you start perseverating and freaking out and assuming that they got into a car accident and they're stuck in a ditch somewhere? Or do you think about what are the facts in this situation? And I shared last week, I think, my son's got ADHD and he will get sidetracked, especially if he's playing video games, and literally lose hours. And so my first thought is, I bet he got sidetracked either talking to his girlfriend or playing video games and just lost all track of time. So I'll try to text him. Instead of automatically getting terrified and panicked, I may get a little irritated, but I'll text him. That is an effective use of my energy. And then I can work up the chain from there. Levi Labs, one of the techniques that I learned when I was in graduate school, that I'll be honest, I don't usually practice, but it was helpful when I had to do it. When we first wake up in the morning, all of our should filters are off. Our autopilot is off when we first wake up in the morning. Now, as soon as you put your feet on the ground, go to the bathroom, get your coffee, whatever, you're in autopilot mode. But when you first open your eyes, you are theoretically in a freer state of mind. And writing for 20 or 30 minutes can help you get some thoughts out and get some clarity when you are doing that. Now, I modify that a little bit. And I'll admit, I tend to do it while I'm drinking my coffee in the morning. I do my lists and my journaling and my mindfulness then. But at that point, I am actually into my should frame of mind. I should do this today. I should do that today. So in order to tap into that creativity, you may consider exploring doing that first thing in the morning journaling. I'm not a really creative person, I'll admit. So anybody else who is creative, if you're an artist, if you're a big thinker, if you have ideas, please share them. Because like I said, that's not my expertise. Well, I'm glad you're starting with us today, Teal Blue. I'm not sure what you mean by cortisol driving brain burn, WJK. What do I do when my doctors put in my chart I'm DID, but never told me and never treated me? If you are in the United States, Sherry, and I know we've got people from all over the world here, so I do need to couch this, but by virtue of HIPAA, you have the right to request an amendment to your record if you don't believe that's an accurate diagnosis. So first contacting that doctor and requesting an amendment to your record if you don't think it's accurate. If you think it's accurate, but they didn't treat you, well, then exploring why that didn't happen, because that's a pretty big issue. That's like a heart surgeon going in and doing a heart surgery, but not treating the person's high blood pressure. The person's not going to be able to heal. So I would be really concerned, even if that doctor or that therapist didn't know how to treat it, DID, if they diagnosed you with it, they should have, and yes, I use the word should, they ethically should have given you a referral to someone who could. Well, I'm glad you're here, JP209. Is PTSD manageable? How long to a cure, and do the pathways have to be redirected? In most cases, yes, PTSD is manageable. I don't want to say it always is, because we're all human and there can be some really severe PTSD. In most cases, it can be managed. In order to go into remission, if you will, in order to not be actively experiencing the symptoms, it depends on the person and the treatment. Some people have found extreme relief in very short order with things like EMDR. There are a lot of different treatments out there for PTSD. EMDR is one of the least invasive. That's why I bring it up, and it has a ton of research behind it. Again, it may not work for everybody, but it's certainly worth considering. It takes the body time to recover. Even once you have processed the memories and you're feeling safer and more empowered, like I talked about earlier, it takes your body a while to recover. Just like if you get an illness, it takes your body a while to recover and learn the new ways of thinking and learn to anticipate things differently than it did when it was in that fight or flight state. I wish I could give you a time frame. In general, it will I can't even give you a time frame. PTSD does take a while to recover, and people with PTSD, myself included, still experience, once you process those symptoms and you're not actively symptomatic, you may still have occasional flashbacks or occasional symptoms that come up. You recognize them for what they are, and you're able to manage them and address them in the moment in a way that helps you feel empowered. Yeah, it sucks. And when those memories come up, but they feel less intimidating. They feel less overwhelming, and you can feel more empowered to handle the situation. The difference between borderline and bipolar. Okay, let's start out. Let's take them one by one. Borderline, as I mentioned, has the splitting, has the irritability, has the unstable sense of self. A lot of times there's abandonment fears in there, emotional dysregulation. Those are all core features of borderline personality. Bipolar disorder is when a person has depression and has had one or more episodes of either mania or hypomania. Generally, there's not the splitting. What you may see is they treat you differently when they're depressed versus when they're in a manic episode, and even differently when they're in a asymptomatic period. People can have borderline and bipolar disorder at the same time. Narcissism is, in my opinion, yet another manifestation of trauma. People learn a way to, all of your personality disorders develop in early childhood or middle childhood, depending on sometime in childhood. And the person develops skills and tools in order to survive that chaotic, traumatic, scary situation. Those skills and tools are continued to be used in ways that were helpful back then in the present, even though in the present they're not nearly as helpful as an ingrained behavior, and they may not have alternatives. PTSD, we've talked about, and that is a response to a trauma. So again, I think when we're talking about PTSD, CPTSD, BPD, a lot of these things are overlapping, and generally, you're not going to have two different personality disorder diagnoses. Now, it's possible, but it's important, in my opinion, not to overload people with diagnoses. If one diagnosis adequately and thoroughly explains what's going on, then that's what it is. You don't want to give them every single diagnosis that could possibly fit. That's a rule out. You want to figure out what diagnosis is actually there. When people start having 3, 4, 5 or more diagnoses, think about how helpless and exhausting and overwhelming that must be to the patient, to the person, to think, oh my gosh, I've got all these things wrong with me. When in reality, they may be reactive behaviors developed to survive trauma. So we're traumatizing with the diagnosis that for disorders that occurred because they experienced trauma. It doesn't make any sense. It is possible. I mean, the person who diagnosed your loved one had reasons for giving all of those different diagnoses. And if I were the person, if I were the client, I'd want to understand how I fit the criteria for each diagnosis and see if there's a way that it could be better explained by trauma. How can one have a healthy relationship with someone who suffers from any of the above? I have a whole series on living with people who have, or being in a relationship with people who have different diagnoses. It's important to remember, being in a relationship with them when they're symptomatic is going to be a lot more challenging than when they are asymptomatic. But also recognizing, for example, if you're a parent or a caregiver or a loved one of somebody with one or more of these, recognizing the function of the behaviors and working with the person to say, okay, this is not ideal. What is it that I can do to be supportive, to be of assistance in this particular situation? Recognizing that it's not going to be the same as being in a relationship with somebody who doesn't have those particular issues. For example, if you get into a relationship with somebody who has 14 different allergies, your life may not be quite the same. If, for example, they have an allergy to cats and you have 4 cats, you've got to figure out whether you're willing to make the compromises necessary to be in a relationship with them, which would mean getting rid of the cats or them being on medication or both. What's the best way to stop porn addiction? There is no easy way. There just isn't. The first thing, obviously, is to get away from the porn. Work with somebody to identify ways to lock down your computer and your mobile devices and stuff so you can't easily access it. Yes, you can go onto some random Wi-Fi network and access it. That's possible. They do have what I call nanny apps that you can put on your phone that report to somebody else if you get on one of those sites that you're not supposed to be on. And when you set it up on your phone, the person who gets the report is the admin, and they are the only ones who can turn on or turn off that app, which that kind of whittles it down to then you'd have to get, another phone or something in order to look at the porn. If you're doing that, then you're not committed to recovery anyway. If you're trying to find every loophole, you're not committed to that recovery. The withdrawals are going to suck. And no doubt about that. There is going to be a period of craving. There is going to be a period of physiological and psychological withdrawal because your body has gotten used to these mega doses of dopamine and endorphins. you will go through post-acute withdrawal syndrome. Maybe not to the same extent as people who use cocaine or heroin or something else, but you will. And it will last for a while until your brain chemistry rebalances itself and heals. It's going to be important to explore all of the beliefs that led you to using porn and kept you going back to the porn, as well as dealing with any issues that you may have about the porn use that involve shame or guilt or whatever. So there's a lot of stuff to be unpacked. You can't just quit using and go, oh, hey, I don't need to use anymore. People who smoke, for example, they can quit using, but smoking, just like porn, whatever that addictive behavior is, it serves a purpose. So you need to figure out what that purpose is and address that purpose. For a lot of people, it's stress relief when they smoke. So they need to find a different way to trigger their vagus nerve. Now think about smoking. Remember, deep breathing and blowing bubbles, both can contribute to activating that vagus nerve, which is akin to taking a really long drag off a cigarette, and then blowing it out slowly. So one of the things that they're doing when they're smoking is triggering that vagus nerve. So we need to help them learn how to do that without the accompanying nicotine, if you will. Home-based therapies for complex PTSD. Evaluating the symptoms, because no two people with any diagnoses present exactly the same way. So looking at the symptoms the person has, looking at the function of those symptoms, and helping them find ways to cope with that. So if they are hypervigilant, for example, that tells me that they're still feeling unsafe and disempowered. So helping them identify tools that in different situations that can help them feel safer and more empowered. Emotional dysregulation, we know that is largely due to a dysregulated HPA axis. So reducing stress and doing what they need to do to help their HPA axis heal is going to be really important. Having compassion with themselves, not getting caught up in dirty discomfort where they're getting angry at themselves for still feeling anxious or angry at themselves for having flashbacks or whatever. They have a flashback, okay, they had it, it sucked. But getting angry about it is only going to prolong their nervous system dysregulation. EMDR can be very helpful, but again, I encourage people when it comes to processing trauma memories to not do it on their own. I know there are websites that will facilitate that, but I don't think it's safe to process intense trauma memories without a safety net. There are medications that are available to help some people. Some people need to start getting better sleep before they can effectively even move into some of these things they need to think about for healing because they're just so worn down and they're so foggy-headed. So again, evaluate the symptoms, evaluate what is maintaining those symptoms and what the function of those symptoms are, and try to help the person develop additional tools to meet their needs and help them feel safer and more empowered. All righty, everybody. That is my time. I appreciate everyone for being here today, and I look forward to seeing you next week.